Hello and welcome. Welcome to the MBLEx review course. I am your instructor, Jodi Scholes, and today we are talking about pathology. Woo-hoo, pathology. So crazy. Pathology specifically is, what it means is the dysfunction or disease. And so as massage therapists, we need to know about dysfunctions in the body, dis-ease in the body, as it relates to massage therapy. So pathology feeds into client assessment, meaning that when someone has a certain pathology, diabetes, high blood pressure, osteoporosis, rheumatoid arthritis, as massage therapists, we need to understand how do we treat them. So that's why we learn about pathology. So today's class is going to go down in 3 rounds. First round is a test-taking strategy. Second round is our learning. And the third round will be dissecting questions on pathology. All right. So in part 1 today, I want to give you a new tool in your toolbox. Now, it may not be new for some of you, but it's a helpful tool to have when you're test taking. So when you're test taking, you're going to be with other people. And I want you to see you are with other people right now. And what we are going to do is we are going to quiet our mind. The tool that's going to be in your toolbox after what we do right now is the breath. The breath is going to be like a tool, like a pair of scissors. We will be able to eliminate distractions when we practice focusing on the breath. And so for about 2 minutes, 3 minutes, we are going to do a centering exercise, a verbal and visual. I would call it a meditation, but you might think of it as just guided, verbal and visual guiding to quiet your body and to quiet your mind. Now, if you're sleepy, you can use this to energize your body and energize your mind. It works both ways, but let's get started. Go ahead and feel your feet on the floor, in your shoes. Wiggle your toes. This is your connection to Mother Earth. This is where your physical body hits the ground, touches the ground. And whether you're on the 2nd floor or you're in an apartment building, it doesn't actually matter. Because that ground underneath you leads to Mother Earth. And so, feel those feet on the ground. Move your feet, wiggle your toes. I really want you to feel it. Excellent. Now, if you're comfortable and if it's safe to do so, you can soften your gaze. You can look down just a little, or you can close your eyes. You can just listen to the sound of my voice. There won't be any pictures. There'll only be just the darkness behind your eyelids or softening your gaze. I want you to take a breath in through your nose. Once you feel your lungs are full, hold on to that breath to the count of 4. When you're ready, exhale that breath out your mouth. We're going to do that 2 more times. And if it's comfortable to do so, we're going to do it to a count of 4. 1, 2, 4, a count 4 in, Account 4 to hold and account 4 out. Let's begin. Breathing in through the nose, 2, 3, 4. Pause, 2, 3, 4. Exhale out the mouth, 2, 3, 4. Great, now just rest for a moment. On this next breath through, if it's comfortable for you to do it, I'd like you to make a little noise, either blowing out birthday candles, or if you have a lot of candles, or even like a little sound. It's going to be the same count. So let's go and we'll begin. Let's breathe in through the nose, 2, 3, 4. Hold, 2, 3, 4. And exhale, 2, 3, 4. Let your breath return to its normal cycle. And we'll do a brief body scan. Starting with our head. How is the head feeling right now with all that fresh oxygen? Down to the shoulders, the back of the neck and the shoulders. Roll those shoulders back. Bringing your attention down the spine to the base of the spine. Feel that seat. Feel the weight of your body on that seat. Feel supported by that seat that you're sitting on. Bringing one hand to the belly. Feel the rise and the fall of your breath. Bringing your attention to your thighs. Maybe placing the hands on the knees. Thank you, knees, for working so well. And then down the front of your legs to your feet, where we started. And imagine you have tree roots coming down out of the bottom of your feet. Tree roots that extend into the earth. And in that earth, your tree roots are bringing in vitality and nutrients, just like the trees do. Only this time, it's the energy of Mother Earth, pure, light, easy, cool. That energy is flowing up the roots of that tree and into your feet, up your legs, up your spine. Mother Earth energy harmonizing your brain, harmonizing with your brain. You may feel a color associated with that. I'm feeling the color green. I see some blues. I see some whites. And bringing our attention back down to our feet, we say thank you to the earth for grounding us in this space, grounding us in the present. We imagine those roots starting to slowly retract out of the earth, back up into our feet. And we say again, thank you. Thank you to Mother Earth for that grounded energy, that opportunity to be present here and now in this time and space. This time and space is divinely ordered. We are all meant to be here now. And when you're ready, you can softly open your eyes. You maybe even flutter them open. And here we are. This practice of focusing on the breath is something you can do for even 30 seconds while taking the MBLEx. It doesn't even take 30 seconds. It takes like 10 seconds to tune in again to your breath. Hello. It takes just a few minutes. We just took just a few minutes just now, and we're leaving behind all that came before. Leaving behind all that came before this morning. Imagining it's in the past, and here we are in the present. The breath is a tool you can come back to over and over again. In the testing room, in traffic, and even today. If you start to feel a little overwhelmed, come back to your breath. Listen to you breathe in through the nose and out through the mouth. It's a beautiful way to stay present. All right. Now that we are fully present, time to study. As mentioned, we are going to be talking about pathology. Pathology for massage therapists. There's so much out there. How do you know what to study? Well, I'm about to show you what you need to study as far as pathology, at least part of it, to safely practice massage and to pass the MBLEx. Welcome back to many of you, and welcome for the first time to some of you. Here is what the Federation tells us is on the test as far as pathology. This is pathology, contraindications, areas of caution, also called endangerment sites, and special populations. So today we're going to do an overview of a few pathologies. We can't get to all of them. But in the online learning center, in our client assessment lecture, you will see many examples of contraindications and special populations, and that's where we cover that material. Also, I wanted to mention that as far as medications, there are no brand name medications on your MBLEx. So that is no longer something you need to study, the brand names. You do need to know the categories of medications, as well as some of the over-the-counter medicine, but only as it applies to how it affects your massage session. So you won't be asked, what is the drug for high blood pressure? What is the drug for diabetes? You'll need to know those session adaptations. As far as diabetes, it's a pathology, and we are going to cover it today. So, all right. Just a quick nod to the scientific term for pathology, and it is called epidemiology. So epidemiology is this branch of medicine that deals with diseases, dysfunction, things that interrupt health. So epidemiology is the medical term. So if you see that term on the MBLEx, know they're talking about pathology. You can substitute the word pathology in this definition. So what do we need to know? Let's get to it. Let's start with some sprains and strains. You do need to know the difference. There's a very specific difference, and trust me, it's easy. It's actually easy. So sprains affect ligaments. This is when there's a stretching, a tearing. Ligaments connect bones to bones. And this is where a sprain can occur. So again, sprains affect ligaments. Strains, with a T, strains affect the tendon. They actually affect a muscle or a tendon. The tendon is that fibrous cord that attaches the muscle to the bone. Ligaments attach bones to bones. Tendons attach muscles to bones. A nice way to remember that is that strains have a T. Strains, T for tendon. You will need to know that tendons attach muscles to bones. Because muscles and tendons are more vascular, they have more blood in them compared to ligaments. Ligaments are more fibrous tissue. Tendons and muscles are more vascular. They have more blood flowing through them. Because of that, when a tendon is strained, you can see this type of coloring, this type of bruising in the area of the strain. That's all you need to know. Sprains relate to ligaments. Strains with a T, just like tendon, strains relate to tendons and muscles. Osteo and rheumatoid arthritis. It's a big topic. We're going to spend a few minutes here. What are the differences between osteoarthritis and rheumatoid arthritis? Can you tell me? Yep, you will be able to after this. All right. Osteoarthritis, it's the most common form of arthritis. In fact, when people tell you they have arthritis, they're usually referring to osteoarthritis. And remember our technique of taking a word and pulling it apart. If you're going to pull that word apart, we're going to pull the word osteoarthritis apart right after Juvie mutes a student, a graduate. Pull that word apart. So can you make two words out of this big word right here? Yeah, this starts with osteo, and you recognize this one, right? Arthritis. Two words. Osteo refers to bones. So this is arthritis in the bones. Yeah. And remember, itis, when you see this, what's happening in the bones? There's inflammation. So bones, artho is joints, technically. So the bony joints have inflammation. So this is what most people are talking about when they say they have arthritis. And this occurs when protective cartilage wears down. We'll see a picture of this. So we're looking at a knee here, but arthritis can occur in any joint. But most commonly, arthritis is affecting the hands, the knees, the hips, sometimes the spine. But this is specifically osteoarthritis. So where do you have some arthritis? Oh, I've got arthritis in my big toes. Oh, I've got it in my knees. Oh, I've got it in my hips. Yeah, some people get it in their spine. But it's an inflammation of the joints between two bones. And it results as, it's because of wear and tear. So that wear and tear on the joint. So again, here we're looking at a knee. And you can see here a little bit of the inflammation. This is a specific technique to try and stimulate some synovial fluid. So joints, most of our movable joints, all of our movable joints are called synovial joints. And in these joints, we have synovial fluid. That's when you're seeing it, synovial fluid. And massage helps to stimulate the movement of synovial fluid. Yeah. So This is one technique. You can look at it another time, but it's more so to show you where the synovial fluid is. It's in this joint capsule, and this is where some arthritis occurs. So ways that people can avoid arthritis is to maintain a healthy weight, to stay active, to do some weight-bearing exercise, and you can really slow down the progression of osteoarthritis with diet and exercise. Yeah, some they say we need it, right? So when working with clients with osteoarthritis, it is within the scope of practice to say, has your doctor talked to you about diet and exercise? We're not talking about weight, yeah, because no. But if you see that they're a person of a larger carriage, meaning they're a little bigger, you can ask, has your doctor talked to you about diet and exercise and how that might help? But also, as you get to know your client, sometimes arthritis is happening in the most healthy people, right? Those people who are out there playing pickleball 3 times a week. Like, oh my gosh, the arthritis is starting to bug me. So it's really not that they're unhealthy. It's just simply the wear and tear on the joints. Now, let's compare osteoarthritis with rheumatoid arthritis. So rheumatoid arthritis is probably what you saw if your parents ever told you, don't crack your knuckles. This is like, oh, look, you'll get big knuckles. No,